Welcome. Thank you for taking the next steps in learning about our Master of Nursing program at the University of Minnesota Twin Cities. I'm going to spend some time today talking about our School of Nursing, and then a little bit of information about the different programs we offer through this School of Nursing. And then I'll go into detail about our Master of Nursing program, some program details, including pretty important information about how to apply. So a little bit to know about the School of Nursing. We are the birthplace of university-based nursing education. We're founded in 1909. So before that, most nursing education took place in hospitals. We were one of the very first schools to take nursing education and move it into an academic setting. We're located in Weaver-Dansford Hall, which is that building you can see in the background of this slide. We're part of the academic health sciences area, and so the Weaver-Dansford Hall is one of 3 buildings that make up that space. And so throughout your time in the nursing program, you spend quite a bit of time in Weaver-Dansford Hall. The School of Nursing offers more than $2 million in scholarships each year, and a good chunk of that is allotted to our Master of Nursing students. So scholarship funding is something that may be available to you. We also have our Benson Healthy Communities and Innovation Center. This is a space on the 4th floor of Weaver-Dansford Hall where you would spend quite a bit of time learning your hands-on skills, being able to practice assessments, and kind of putting yourself in different situations that mimic what you're going to see when you're out practicing nursing in the real world. So we have clinical settings, we have public health settings, we have an ICU setting, and that Benson Healthy Communities Innovation Center was completely redone in the fall of 2014, and so everything is still quite new and updated, and really allows our students to get a chance to practice their hands-on skills before going out into actual clinical settings. So let's talk a little bit about the different programs offered through the School of Nursing. We have 4 overall programs. Our first is the Bachelor of Science in Nursing, and that's our traditional undergraduate BSN program. So it's a 4-year program, 4-year degree, designed for kind of the traditional college-age student. And that program is at both the University of Minnesota Twin Cities location as well as our Rochester location. And then we have our Master of Nursing program, which is why all of you are here. This is an entry-level nursing program. It's our version of an accelerated BSN program. Both the Bachelor's of Science in Nursing program and the Master of Nursing program are considered to be pre-licensure programs. So they're programs that allow for you to earn your licensure to become a nurse. Then we have our Doctor of Nursing Practice program, and this is a program for folks to pursue who are interested in becoming a nurse practitioner, nurse anesthetist, nurse midwife, clinical nurse specialist, any sort of advanced nursing degree. That would be through the Doctor of Nursing Practice program. So if any of you have parents who are in the nursing field or some older adults who are in the nursing field, it's quite likely they have a Master's of Science in Nursing with a specific specialty. That Master's of Science in Nursing has kind of morphed into the Doctor of Nursing Practice. More and more employers were starting to say they wanted their nurses prepared at the doctoral level, not just the Master's of Science level. And so we accommodated that and got rid of the Master's of Science in Nursing about 10 years ago and picked up the Doctor of Nursing Practice program. So for anyone interested in an advanced degree, that would be through the Doctor of Nursing Practice program. Then we also have our PhD in nursing. The PhD in nursing is the research side to nursing. So if while you're pursuing a licensure degree, you get bitten by that research bug and really want to pursue the research side to nursing, you would do that through your PhD in nursing. And the U of M Twin Cities has the largest PhD in nursing program in the state. So now let's talk a little bit more in detail about the Master of Nursing program. So it's designed for people who have a non-nursing undergraduate degree. So folks who have a bachelor's degree in any area other than nursing are eligible for the Master of Nursing program. And again, it's comparable to our version of an accelerated BSN program. So you're eligible for nurse licensure as an RN after 16 months. There is no specialty tied to the Master of Nursing program. It's an entry-level degree with no specialty attached to it. So when you finish the Master of Nursing program, you're considered to have the same type of degree as someone with a Bachelor's of Science in Nursing. So you're an entry-level nurse prepared for entry-level nursing jobs. The Master of Nursing program is not the same as a Master's of Science in Nursing with a specialization. So as I mentioned earlier, about 10 years ago, employers started to state that they were really looking for folks prepared as a doctor of nursing practice level, not the masters of science in nursing level. And so it used to be that for a long time you did a master's of science in nursing with a specific specialization. And this program is not the same as that. So the Master of Nursing, again, is entry level, while a Master's of Science in Nursing with a specialization would qualify you to be a specialized nurse in a specific area. When you're researching different nursing programs, you'll want to be a little bit careful just to kind of look into the different programs and exactly what their degree offers. For us, the master's degree is entry level without a specialization. For some other schools, it's possible that they are going to have a specialization. So you just want to keep an eye out on that while you're looking at different programs. And then our Master of Nursing program is a cohort model. So we admit 64 students each fall, and you'll spend all 16 months together. You'll do fall semester, spring semester, summer semester, fall semester, and then graduate. So the 64 of you will spend quite a bit of time together, get to know each other, and learn from one another. A little bit about the Master of Nursing coursework and practicum experiences. So as I just mentioned, it is 4 consecutive semesters, fall, spring, summer, and fall. So it's pretty quick, pretty intense. There are 51 total credits in the program, so we do get you through quite a bit of coursework in those 4 semesters. It is graduate level coursework, so while you're not earning a nursing graduate degree, you are doing coursework at the graduate level. What can be nice about that is if you do decide to pursue a Doctor of Nursing Practice degree down the road, many of those programs will require some prerequisites or maybe have some required coursework at the graduate level that you could get credit for having earned that while in the Master of Nursing program. It is a full-time schedule with 11 to 15 credits per semester. So you do stay pretty busy, and it's a traditional day program. So classes go from about 8 a.m. to 5 p.m. Monday through Friday. And that includes your early on practicum experiences. Practicum will typically be 1 day a week from about 8 to 5. It gets a little more intense and busier than that as you move your way through the program, but for the most part, you can expect Monday through Friday, 8 to 5. You may have some semesters where you have breaks in between your classes, but for the most part, we ask that students keep those schedules clear. Because of that, it's recommended that you don't work while in the program. Our class schedule is pretty strict. Classes for the Master of Nursing program are offered at one time to that cohort, and that's it. And so it can be pretty tough to hold down another job at the same time. It's also a very intense program. We really get you through a lot in those 16 months. And so between learning the academic side to nursing and then your hands-on skills in nursing and then going into your practicum or clinical experiences, it really does take most of your time. And so we don't recommend you have a job while in the program in order to allow you to be able to focus as much on the program as possible, while also keeping your schedule available for whenever your classes and practicum requirements might be. Practicums are throughout your 4 semesters in the program. You'll spend time in psych mental health, in medical surgical, in mother-baby, in public health, and in pediatrics. So all of you will spend time in all 5 of those areas. And then you'll also have an immersion experience in your final fall semester of the program. And so our goal with bringing you to a lot of different areas in your first 3 semesters of the program is to expose you to a little bit of everything. And that way you get a sense both of what you like for a specialty and also maybe what you don't like for a specialty. And then in that final fall semester, you do get to pick your top 3 choices of where you would like to be for your immersion experience. And then practicum experiences are throughout the Twin Cities metro area. So you may spend time right in St. Paul or Minneapolis. You may go out to one of our farther out suburbs. You may spend time at a school. You may spend time in a hospital. It's really all over the place. We try to give you a really large variety of experiences for your practicum experience.
All right, so now let's get into information about the application process and some of our requirements for the application. So we do require a baccalaureate degree from an accredited institution in a non-nursing area of study. And as mentioned before, this can really be in any area at all. Political science, education, art history, biology. These majors that we see from our applicants really are all over the place. And so as long as it is a undergraduate degree in an area other than nursing, then you will meet our requirements. We also do require a minimum degree GPA of 3.0 or higher from your most recently completed degree. So if you've completed a master's degree or maybe a JD or a PhD, that's the degree we will look at. So it's the degree GPA from your most recently obtained degree. What's important to know about degree GPAs is that those do not change once they have been earned. So let's say in your undergraduate degree, maybe your freshman year or sophomore year didn't go so great. And so you ended up graduating with a 2.83. Then that would be your final degree GPA. So unfortunately, classes taken after earning a degree are not factored into a degree GPA. So you'll want to take a look at your most recently obtained degree and make sure that that GPA is a 3.0 or higher. And classes that have been taken after earning that degree would not be factored into the GPA. So that's just something important to think about. We also will look for successful completion of our prerequisites, and I'm going to get into details about our prerequisites in just a little bit here. But we have 9 required prerequisites. All of them must be earned for a grade of C+ or higher. So we'll get into more details on that in just a minute. We also require an interview that is by invitation only, but we do require an interview as part of the final application process. And then we also require English proficiency scores for those who it's applicable for, and you can read more about that on our website as well. We accept either the TOEFL or the IELTS. Either one is just fine. We also will take the MELAB, although that one is getting harder to find, but we will accept the TOEFL or the IELTS. One thing you'll notice if you've looked into our program before or you've applied before, we are no longer requiring the GRE as part of our application process. So the GRE used to be required for all applicants unless they'd earned a graduate degree, and that is no longer the case. So we decided moving forward, partially in light of the pandemic, that it made access to the GRE pretty difficult, but moving forward, we are no longer requiring the GRE. So that is not something you need to worry about. And we won't accept a GRE score either. So even if you think, I'm going to take it, maybe it will go really well, we won't accept any GRE score. So not something you need to take, nor is it a score that we will accept.
So in order to apply to the program, we use an online application called NursingCast. And NursingCast is a centralized application service for nursing programs. So what's really great about it is if you're applying to multiple nursing programs and they all use NursingCast, you only have to do one application. It's a little bit like the common application for undergraduate programs, if any of you did that. So the NursingCast application, you'll find it online. And what's great is you can apply, let's say, to our school and to St. Scholastica and to Rush University and to Johns Hopkins. So you have a lot of options for how many schools you can apply to. And what's nice is all of your materials can be shared amongst those schools. So you can do that one simple application and then apply to multiple programs. So we do use NursingCast. What's really nice too is we have some very specific detailed application instructions that walk you through each section of NursingCast and exactly what we require for that. So we would encourage you to spend some time on the detailed applications page as well, learning about how to apply through NursingCast.
Okay, so now let's spend some time looking at what we're looking for when it comes to reviewing someone's application. And these are what we consider to be minimum application requirements. So if any of these requirements aren't met, it means we unfortunately cannot consider you for the program. So we'll look for the following for our November 1st deadline. We'll look for our NursingCast online application. And that, again, that's the only way you can submit to the program. So that should be no problem for any of you. We'll look for a minimum of 5 completed prerequisites for a letter grade of C+ or better. And this is a change from other years. In the past, we've required a letter grade of C or better. Now we do require a letter grade of C+ or better. So it's something to keep in mind when it comes to your prerequisites. We will require an application fee, which you can't submit your NursingCast application without it, so that shouldn't be too much of a barrier. We'll look for an essay response, and we have specific questions that we are asking you to respond to. You can find those in your NursingCast application when it opens on September 1st, so we'll look for that essay response. We'll look for your resume. There is no cover letter necessary. We really use your essay in place of a cover letter. We'll look for 2 letters of reference with their forms, and letters of reference with NursingCast is pretty easy. You'll enter in the information about your reference, and email will get sent to them. They fill out their form online, they upload their letter of reference and send it off, and NursingCast then will automatically upload that letter to your application, so it's a pretty smooth process there. We'll look for official transcripts from all institutions attended. And this is important because this includes any institution where you have earned college credit. So maybe in high school you did post-secondary enrollment opportunities or college in the schools, and so you earned credit at a local school. We'll need a transcript from there. If you have earned any college credit at all, we'll need to see that transcript. So that's something to keep in mind. Just you'll really want to carefully think through all of your college education and make sure that you send an official transcript for that to NursingCast. And then, as mentioned earlier, again, we'll look for English proficiency scores if applicable, so you'll want to keep that in mind too. You'll see on the bottom of the slide here, we have primary and secondary factors as well as detailed application instructions linked. You can find both of those on our website, and those can be really helpful for kind of just taking a look at our primary and secondary factors and getting a better sense of what exactly are we looking for, and kind of do I tentatively meet those requirements.
And now let's get into some details about our prerequisites, because we know that this is a big one for a lot of you applying. So we have 9 required prerequisites for the Master of Nursing program, and there's a lot of details that kind of go into all of these. So hang tight for the next few minutes while we go into detail about this. I also really, really want to encourage you all to spend some time on our prerequisites webpage on our website. This includes all of the information I'm about to tell you. It's all written out and can really help students to understand exactly what is or isn't required when it comes to prerequisites. So we have 9 prerequisites. There's general chemistry, human anatomy, human nutrition, lifespan growth and development, abnormal psychology, inferential statistics, human physiology, microbiology, and pathology. You'll see that those last 3, human physiology, microbiology, and pathology, have an asterisk next to them. That's because there's a 10-year time limit on those 3 prerequisites. So those classes cannot be more than 10 years old by the start of the Master of Nursing program. So you want to keep that in mind if maybe you graduated a little while ago and have been out in the career field working in your area and now you're looking into nursing. You'll want to keep in mind that those 3 courses cannot be more than 10 years old. Otherwise, for the remaining 6 prerequisites, those can be done at any point in time, anywhere from this semester to 20 years ago, whatever works for you. So a lot of people have questions about their prerequisites and how to know if they're going to meet our requirements or not. And our prerequisites webpage, again, goes into a lot of detail about this. And so what we have on our page listed out is for each prerequisite, we also have a course description of what we're looking for. So when you're on our webpage, you'll note that we have a few different prerequisites that have asterisks next to them. So there's 5 of those courses. It's general chemistry, microbiology, human anatomy, pathology, and human physiology. So for those of you who are applying who maybe have non-science backgrounds, that's absolutely fine. We strongly encourage you to apply. But if you don't have a science background, we would encourage that at least 3 of your 5 prerequisites be one of these stronger science classes. So that would be chemistry, microbiology, anatomy, pathology, physiology. And that's why we have those starred on our website. Having at least 3 of your 5 completed prerequisites be in the sciences really helps us out for those of you who maybe are coming from a BA degree to help us understand your science skills. So again, you want to take a pretty careful look at our prerequisites page for that information. And then what's really helpful on this prerequisite page too is we go into detail about each class that we require and what content we're looking for. So we know that not every school calls every prerequisite the same thing as us. So on our prerequisites page, what's really nice is it's going to walk you through exactly what courses we require and what we're looking for that content. So for general chemistry, we are looking for a course that is a college level general chemistry course or one chemistry won't meet our requirements either. So you want to pay pretty close attention to what we're looking for with that one. For human anatomy, we're looking for a course that covers all aspects of human anatomy. Again, a lab is not required, but may be helpful. Some schools will combine anatomy and physiology and offer a 2-course series, so maybe A&P1 and A&P2. And that's fine, but you do need to make sure that you take both courses in order to fulfill the anatomy and physiology requirement. And then courses like comparative anatomy or animal anatomy, those will not meet our prerequisite requirements. For human physiology, we're looking for a course that covers all aspects of human physiology. A lab is not required, but may be helpful. And again, if you're doing a 2-part course, you'll need to take both A&P 1 and 2, and comparative or animal physiology courses do not fulfill the prerequisite. For microbiology, we need a course that covers the principles of microbiology. A lab is strongly recommended but not required. The lab we find really helps students to kind of fully understand the concepts in microbiology, to have a really good solid understanding of the course, which helps them out once they're in the Master of Nursing program. But it's not required. An appropriate course would include all or most of the following: bacterial metabolism, growth and genetics, biology of viruses and fungi, microorganisms and disease, a molecular cellular biology, or an immunology course are not appropriate. So please keep that in mind when picking your class. For a lifespan growth and development requirement, it's just a developmental psychology course, but it does need to cover the entire human lifespan. So that's infancy through older adult or death. Some programs or schools will offer maybe developmental psychology of birth through adolescence and then adolescence through death. You would need to take both of those courses in order to meet the requirements. So just keep in mind, for developmental psychology, it does need to be infancy through older adult or birth through death. For human nutrition, this is our one course that can be 2 credits instead of 3, although we do prefer 3 credits. And we're looking for a course that addresses topics such as essential nutrients needed for the diet, major functions of nutrients and physiological changes with deficiency or excess, digestion, absorption, and metabolism of nutrients. Courses that only discuss topics such as diet fads or maybe nutrition for the everyday athlete are not appropriate. It needs to be a general human nutrition course. For abnormal psychology, we are looking for an overview of a wide range of mental disorders, as well as descriptive information including prevalence rates, ages of onset, and cultural differences. A general psychology course will not fulfill this requirement, so you'll want to keep that in mind. Abnormal psychology is sometimes called psychopathology, and that's fine. We can take that course too. For inferential statistics, it's unlikely that you're going to find a specific class called inferential statistics. There's a lot of different math classes that can meet this requirement. This class is specifically required because you will take a graduate level research course during the MN program, and so we really want to make sure that you're well prepared for that. And so the appropriate course needs to include methods of statistical estimation and inference, so hypothesis testing. It also would be great if included some or all of the following: sampling methods, experimental design, data exploration, data modeling and simulation, normal distribution, simple linear regression, along with a lot of additional topics. So you'll want to look pretty carefully at a course you took and see if it covers these areas. Again, it's unlikely you'll find something specifically called inferential statistics, but we often find that a general statistics class meets these requirements. If you've done biostatistics, that typically meets the requirements too. So you'll just want to spend some time looking through different course descriptions to see if it covers what we're looking for. And then human pathology is probably going to be one of the harder classes you'll find to fill the requirement. We are one of the very few nursing programs that requires that you take human pathology before starting the program. Because we get you through that program in just 16 months, we do have quite a few prerequisites that you would take ahead of time that for some other nursing programs you maybe wouldn't take until once you're in the program. So pathology can be tough to find. We have 2 different classes that are offered online through the U of M Twin Cities. That's LAMP 4177 and Pub H 6355. There also are quite a few online options. There's one through Riverland Community College as well as Portage Learning. So you do have some options for sure. Just know that you might have a little bit of a harder time finding a course offered online. We're happy to help point you in the right direction if you're looking for them. But again, for human pathology, so we're looking for a course covering general and organ system pathology. So an appropriate course would include all or most of the following: understanding human disease as an alteration of normal structure and function, understanding the concepts and underlying general pathology and correlating these patterns with specific diseases in different organ systems, becoming familiar with common terms used in clinical medicine and pathology, and the frequently used suffixes and prefixes. So you do want to be pretty careful when it comes to what class you're going to take to fulfill this requirement, because we are very particular about our pathology requirement. Human pathology is also sometimes called pathophysiology, and so just know that that course would also meet our requirements. All right, so that's a lot of information about prerequisites. A few more details about that. So prerequisites need to be, at least 5 of them must be completed before the application deadline. And so we have an application deadline of November 1st. And so by this point in time, at least 5 of your courses have to be complete for a letter grade. So courses that are still in progress for the fall semester would not count towards these 5 completed prerequisites. All of your remaining courses must be completed prior to entry if you're admitted to the program. And then, as I mentioned before, if you're coming from a non-science background, at least 3 science courses are suggested as part of your 5 that are needed to apply. Your course content needs to match the required content. They need to be taken at an appropriately accredited college or university. And then we also have petitions and coursework evaluations that you can certainly use, but we ask that you use those sparingly. So, one thing that's important to know, on our prerequisites page, we have quite a few different resources listed for how to determine if your courses are going to transfer to meet our requirements. The best resource we have is transferology.com, and in that case, what you can do is enter in the courses you've taken and where you've taken them, and ask to be shown how it matches to the University of Minnesota Twin Cities. And so that's kind of your best jumping off point. We also, on our prerequisites website, though, have prerequisite transfer guides. And so what we've done is we have gone through and looked at all of the Minnesota 4-year colleges and universities, public institutions, so both 4-year and 2-year institutions, private institutions, Minnesota 2-year colleges, and then the University of Wisconsin system as well. So you can look on our prerequisite guides online, and you can see exactly which courses from which schools will transfer to meet our requirements. So we would encourage you to spend time looking through our prerequisite guides, as well as spending some time on Transferology to look through your different courses that are required. One quick thing to note, so we do not require a lab with any of our prerequisites. They can often help students out with understanding the content better, but we don't require it. However, some states, depending on where you want to get your licensure, are going to require labs with your courses. California is a main one we know about, but so you do want to be careful that if you're planning on earning your license in a state other than Minnesota, it's worth checking with them to see what coursework they might require comes with a lab, just in case that does become a problem for you. And then that way, if you take general chemistry and don't take it with a lab, and then, 2 years down the road want to go practice in California and you're missing that lab piece, you don't have to do it then. So do keep an eye out for that just in case. Again, all of this is listed on our website. So do spend a lot of time on that prerequisites planning page to really learn a lot more about the prerequisites. If you have a course that you think meets our requirements, but you can't quite tell, or it's called something different, or you maybe have 2 or 3 different courses that you want to try to piece together to cover a course, you can go ahead and submit a course equivalency petition. Again, there is a link to that on our prerequisites webpage. So you can submit that course equivalency petition, and we can have any of our faculty review it to let you know if it might still meet our requirements, so you don't have to take another class. All right, let's talk a little bit about our admissions profile from the class from this past year, just to kind of help give you a sense of what things look like in terms of kind of competition for being admitted to the program. So this past year, we had 240 total applications. Of that, we interviewed 100 people, and then 64 were accepted into the program. So you will note that it is a pretty competitive program. We do have quite a few very well qualified applicants who unfortunately each year we just do not have space for. So something I always encourage applicants when they're considering different nursing programs is you want to consider applying to more than just one program. Unfortunately, just in general, nursing programs are quite competitive, and ours is no exception to that. A little bit of kind of a sense of the profile of the overall class. So the average cumulative GPA, again, that's that degree GPA, was a 3.58. The average prerequisite GPA was a 3.73. The class was 84% women and 16% men. We had 17% persons of colors. And then that average GRE score, so the verbal was a 156, quantitative was a 153, and analytical writing was a 4. So it's important to remind everyone here that we do a very holistic review of all of our applications. So there's no one thing that matters more than anything else when it comes to the application. So we're going to look at your degree GPA, we're going to look at your overall GPA, we're going to look at your prerequisite GPA, we'll look at your GRE score, we'll look at your relevant experience in the nursing profession. We'll look at your career motivation. We'll look to see if you have any research experience. There's really a lot that goes into everything we consider when reviewing an applicant. And again, you'll see those listed out on our primary and secondary factors that we have listed on our website. But we do like to give folks just kind of an overall sense of what each year's admitted class looks like, just to help people understand kind of where they might fall within the area. As far as financing goes, so tuition for the Master of Nursing program is per credit. And so the school year 2020-2021 rate is $701 per credit, and that's for both residents and non-residents. And again, a reminder, there are 51 credits for the Master of Nursing program. University fees are approximately $1,500 a semester. Books are approximately $2,000 for all semesters. You will pay quite a bit of that right at the beginning. We do a book bundle situation where we work directly with the publishers to put all of your books into one big bundle, which they give you a pretty nice discount on. And then there are a few more books you'll buy throughout the program. And then optional to buy a stethoscope if you'd like. Otherwise, we do require that you have at least one pair of scrubs. Those are $30 each. Most people will buy probably 2 sets of scrubs just so that they have some options beyond just the one pair in case they get dirty. We also have a page on our website that goes into detail about the finances for the Master of Nursing program. It goes into your fees and tuition for each semester to help give you an overall sense of exactly what you're looking at when it comes to cost of the program. We do know that cost of the program is pretty important for a lot of people, and so we try to be very transparent with what we require for that. And so we have a really nice kind of breakdown on our website of exactly what each thing is going to cost you. Depending on where you're coming from and if you need insurance or what you decide for fees or books or anything, the total program cost is going to be between $47,000 and $51,000. And again, on our website, we break down kind of the cost for different things so you can see exactly where your money would be going and what the program would likely cost you. It is required that all students have health insurance. That's approximately $1,000 a semester. If you're already insured, then the plan can be waived. So that's part of what factors into how much you're going to pay overall for the program, is if you have insurance or not. As I mentioned earlier, we do have specific School of Nursing scholarships, and for the Master of Nursing program, it's determined at the time of admission. And the amount we have available to distribute really varies each year, but you will know when you're offered admission if you've also been offered a scholarship. We do require a completed FAFSA for both need-based and merit-based scholarships. So even if you think you might not qualify for any need-based scholarships, we still encourage you to submit the FAFSA because we cannot award any scholarships without that. So again, both need-based and merit-based scholarships require a FAFSA. So we would encourage you to submit the FAFSA potentially when you submit your application. Otherwise, some people will wait until they find out if they've been offered an interview or not, and if they have been, then they'll complete their FAFSA at that point in time. Other resources, we do encourage you to look for external funding. We have an external funding link on our website. You also can look at things like fastweb.com or even just basic Google searches. What's great is that there is a real need for nurses in the world right now, particularly as more and more of the older generation are retiring. And so we really would encourage you to look into any external funding you might have. For non-degree seeking students, for those of you who are considering taking care of your prerequisites through the University of Minnesota Twin Cities, we have what's called a prerequisite coursework certification form. So financial aid does have loans available for designated prerequisite coursework. So these loans are available specifically for students if they need to complete prerequisites to apply to a program. You'll do the prerequisite coursework certification form for that. We are extremely familiar with that form. You can go ahead and fill out your area of it and then send it to us for the advisor area. We'll sign that and send it back to you. So the financial aid for that, it can be pretty nice, especially if you do have quite a few prerequisites you need to complete. So if you're considering doing that through the U of M Twin Cities, you can go ahead and submit that form to us. You can just email it right to gofornursing@umn.edu. So you've probably seen this phone number and email quite a few times, but if you have any other questions, we really do encourage you to reach out to us. You'll see our phone number there as well as our email, so that gophernursing@umn.edu. It goes right to me as well as many of my colleagues. So if you have any questions at all, we would encourage you to email us. If you're considering taking your prerequisites through the U of M Twin Cities, you do that through the College of Continuing and Professional Studies. So we have their phone number and email there. And then also our Office of Student Finance can be really helpful if you're just trying to get a better sense of what are your options for financial aid for prerequisites or throughout the program. So we also have contact information there for our Office of Student Finance. So now let's get a little bit into some of our frequently asked questions here. So a big one we get from a lot of people is, do I need a car for this program? And the simple answer is yes. The slightly more complicated answer is that it would be okay if you didn't have one. So the way it works, a car can be helpful when it comes to your practicum or clinical experiences. For your first few semester, your practicum experiences will be group practicum, and so it's quite possible that you could carpool with anyone else in your group to get your practicum requirements. But a car can be helpful in your final semester when you're doing your one-on-one immersion experience with a nurse, just because that will help open up your possibilities of where you can be placed. But you certainly would not need one right away for the very beginning of the program, but it is something you'd want to think about for down the road. Do I need to have a CNA license for the program? You do not. No. We every year have a few applicants who do have their CNA license, and when it comes to taking their lab skills class in the program, I think they do feel a little more confident about where they're at, but it's absolutely not required. The majority of our applicants do not have a CNA license for the program. If any of you are interested in pursuing a DNP specialty after the Master of Nursing program, that's great. We super encourage that. Pretty much every specialty that we have is going to require at least 1 year of nursing experience first before you pursue the DNP program. And so the way that would work is you'd finish your Master of Nursing degree, you'd work for a year or two or however many you want, and then you would go ahead and pursue the Doctor of Nursing specialty in your area. So there is currently not an option to go directly from the Master of Nursing program into a Doctor of Nursing practice specialty, just because so many specialties are going to want you to have at least a year of experience first. We don't save spots for our Master of Nursing students in that Doctor of Nursing practice program, but what is nice is when you do apply to the DNP program, the faculty and specialty coordinators of that area are very aware of the rigor of the Master of Nursing program and what the coursework looks like, and so it certainly helps them to feel confident in your ability to keep up with the program. So while we don't save spots for you all, it certainly doesn't hurt to be coming back to the program after completing the Master of Nursing degree. Well, that is all the information we have for you for today. We know that this can be a lot of information to get all at once, covered a lot of topics in today's presentation. So if you have other questions or if you think of other things, please don't hesitate to reach out to us. Again, as we've probably given to you multiple times, the gophernursing@umn.edu is a great resource. So go ahead and email us with any and all questions you might have. And oftentimes, too, depending on what the question is, if it turns out a phone call will be easier, we're happy to set that up to connect with you in whatever way makes the most sense. Otherwise, we really do encourage you to spend quite a bit of time on our website reading through our different pages about the Master of Nursing program. All of today's information came from those web pages, and so they really can be helpful for applicants just kind of figuring out their next steps and exactly what to do. And again, please don't hesitate to reach out with any and all questions you might have with gophernursing@umn.edu. Thank you.